The notion that all vegetables are unequivocally beneficial for human health, forming an immutable foundation for a nutritious diet, especially as individuals gracefully transition into their senior years, is a deeply ingrained societal assumption. This pervasive belief, while largely accurate in its general sentiment, warrants a more nuanced and sophisticated examination. A closer, more critical inspection of our dietary landscape reveals a fascinating and often overlooked reality. Certain vegetables, long championed as stalwart allies in our pursuit of wellness, can, paradoxically, begin to exert a subtle yet significant influence on increasing the risk of cerebrovascular accidents, commonly known as strokes, particularly for individuals who have surpassed the age of 60. This phenomenon is not an indictment of specific foodstuffs, nor is it an attempt to instill fear or demonize the bounty of nature's produce. Rather, it is an exploration of the intricate and evolving relationship between our bodies and the foods we consume, a relationship that undergoes profound transformations with the passage of time. As our biological systems age, they adapt and, in some instances, recalibrate their metabolic processes, leading to a differential response to nutrients and compounds that might have been readily processed and beneficial in earlier stages of life. Several physiological changes commonly associated with aging contribute to this altered dietary susceptibility. Kidney function, for example, tends to decelerate, impacting the body's ability to efficiently filter and excrete waste products and mineral excesses. The elasticity of blood vessels can diminish, leading to increased stiffness and a greater propensity for constriction or dilation issues. Furthermore, the prevalence of pre-existing health conditions and the concomitant use of a diverse array of supplements and prescription medications, often necessary to manage age-related ailments, can create complex biochemical interactions. These interactions can, in effect, transmute a food item that was once a dietary hero into a potential concern, necessitating a more informed and personalized approach to eating. Understanding these subtle shifts in physiological response is paramount for seniors seeking to optimize their health and mitigate risks, transforming knowledge into empowered dietary choices that prioritize well-being and longevity. The focus shifts from broad dietary pronouncements to a personalized understanding of how individual bodies respond to specific nutrients within common foods, especially when these bodies are navigating the unique biological landscape of later life. Among the pantheon of highly regarded vegetables, spinach stands out as a prime example of this complex duality. It is a leafy green powerhouse, celebrated for its abundant reserves of essential micronutrients, such as iron, crucial for oxygen transport, magnesium, vital for numerous enzymatic functions and muscle health, and a rich spectrum of antioxidants, instrumental in combating cellular damage and inflammation. However, within this verdant treasure trove lies a substance that, under specific physiological conditions, can present a challenge: oxalates. In younger, healthier individuals, the oxalates present in spinach are generally managed effectively by the body. They can bind with calcium in the digestive tract, and a significant portion of this complex is then excreted. The issue arises in older adults, where a common age-related decline in kidney function can impair this efficient filtration process. As the kidneys become less adept at eliminating excess substances, the oxalates in spinach, when consumed in significant quantities, can more readily bind with calcium in the bloodstream itself, rather than solely in the gut. This binding can lead to the formation of calcium oxalate crystals. These microscopic crystalline structures, circulating within the arterial system, can contribute to the gradual narrowing and hardening of arteries, a process known as atherosclerosis. The arteries that are particularly vulnerable are those supplying the brain, the carotid and vertebral arteries. A significant narrowing or complete blockage of these vital conduits can dramatically increase the risk of a stroke, a medical emergency that occurs when blood flow to the brain is interrupted, leading to the death of brain cells. Therefore, for seniors, especially those with a history of kidney issues or a predisposition to cardiovascular problems, the consumption of spinach requires careful consideration. To mitigate this potential risk, it is advisable to consume spinach earlier in the day, allowing ample time for the body to process and excrete any excess oxalates and calcium. Furthermore, a proactive dialogue with a healthcare provider is indispensable. Discussing dietary habits, particularly the consumption of high oxalate foods like spinach, And understanding individual kidney and heart health status allows for personalized recommendations and the potential adjustment of medication regimens if necessary. This approach ensures that the nutritional benefits of spinach can still be enjoyed, but in a manner that aligns with the unique physiological needs of an aging body, safeguarding against unintended health consequences and promoting continued well-being through informed dietary choices. Broccoli, a cruciferous vegetable universally recognized for its robust nutritional profile, including substantial amounts of vitamin C, fiber, and various phytonutrients, also presents a noteworthy consideration for certain segments of the senior population, particularly those undergoing anticoagulant therapy. The primary concern with broccoli in this context stems from its exceptionally high vitamin K content. Vitamin K is a fat-soluble vitamin that plays a pivotal role in the cascade of biochemical reactions responsible for blood coagulation. It is essential for the synthesis of several proteins in the liver that are crucial for forming blood clots, thereby preventing excessive bleeding. For individuals prescribed blood-thinning medications, such as warfarin, Coumadin, or newer oral anticoagulants, maintaining a stable and predictable level of blood coagulation is paramount. These medications work by interfering with the action of vitamin K or its metabolic pathways, effectively slowing down the clotting process and reducing the risk of dangerous clots forming in the bloodstream, which can lead to strokes or pulmonary embolisms. The inherent variability in the vitamin K content of fresh produce, including broccoli, can pose a challenge. If a senior consistently consumes large quantities of broccoli or experiences a sudden and significant increase in their broccoli intake, it can lead to an influx of vitamin K that overwhelms the intended therapeutic effect of their anticoagulant medication. This can result in a diminished efficacy of the blood thinner, effectively making the blood less thin than intended, and potentially increasing the risk of clot formation. Conversely, a sudden decrease in vitamin K intake while on these medications could lead to an excessive thinning of the blood, increasing the risk of bleeding. Therefore, consistency in dietary habits is absolutely critical for individuals on anticoagulant therapy. It is not necessarily about complete avoidance of broccoli or other vitamin K-rich foods, but rather about maintaining a steady and predictable intake. This allows the healthcare provider to accurately calibrate the dosage of the anticoagulant medication to achieve the desired therapeutic effect without causing undue risk. Open and ongoing communication with one's doctor about dietary habits, including any changes in the consumption of vegetables like broccoli, is therefore an indispensable component of managing this aspect of senior health. This collaborative approach empowers seniors to continue enjoying the health benefits of nutrient-dense foods while ensuring the safe and effective management of their medical conditions, ultimately contributing to a higher quality of life and reduced risk of serious complications. Romaine lettuce, a popular choice for light salads and often perceived as an innocuous and hydrating component of a meal, can also introduce a subtle but potentially significant risk for older adults, particularly when consumed in the evening. This risk is linked to its natural diuretic properties. Diuretics are substances that promote diuresis, the increased production of urine by the kidneys, which leads to a reduction in the body's fluid volume. While this can be beneficial in managing conditions like hypertension and edema, in seniors, especially when combined with other factors, it can have an unintended consequence. As individuals age, their physiological ability to regulate fluid balance can become less robust. Furthermore, many seniors are prescribed medications that also have diuretic effects, such as thiazide diuretics or loop diuretics, to manage conditions like high blood pressure or heart failure. When romaine lettuce is consumed, particularly in a substantial quantity or late in the day, its diuretic action can contribute to a state of mild dehydration. This dehydration, even if not acutely symptomatic, can lead to a subtle but important physiological change, an increase in the viscosity or thickness of the blood. A more concentrated blood, with a reduced fluid component, becomes more prone to clotting. This effect is compounded when the diuretic action of romaine lettuce is combined with other diuretic medications, amplifying the fluid loss and further increasing blood thickness. This increased propensity for clot formation, particularly overnight when the body is at rest and circulation might be slightly slower, can elevate the risk of developing blood clots that could potentially dislodge and travel to the brain, leading to a stroke. To mitigate this risk, a simple yet effective strategy involves mindful consumption timing. Enjoying romaine lettuce as part of a lunch or an earlier meal allows the body more time to rehydrate and rebalance its fluid levels before the nighttime rest period. Ensuring adequate hydration throughout the day by consistently drinking water and other fluids is also paramount. This helps to counteract any fluid loss induced by diuretic foods or medications, maintaining optimal blood viscosity and reducing the overall risk of clot formation. By understanding the subtle physiological effects of common foods and integrating this knowledge into daily eating patterns, seniors can continue to enjoy the benefits of a healthy diet while proactively managing potential health risks, thereby promoting sustained well-being and independence. Raw carrots, a vibrant and widely consumed root vegetable, are frequently lauded for their rich beta-carotene content, a precursor to vitamin A essential for vision, immune function, and skin health, and are also packed with other beneficial antioxidants and fiber. However, for older adults, especially those with pre-existing metabolic challenges or those who are not accustomed to consuming them raw in large quantities, raw carrots can present an interesting, albeit manageable dietary consideration. The primary concern revolves around their impact on blood sugar regulation. While carrots contain fiber, which generally helps to moderate sugar absorption, raw carrots, when consumed in larger portions, can still lead to a relatively rapid influx of sugars into the bloodstream. This is because the natural sugars present in carrots are released more quickly when the vegetable is in its raw, unprocessed state, compared to when it is cooked, which breaks down some of the plant's cellular structure. In older adults whose metabolic processes, including insulin sensitivity and glucose tolerance, may have naturally declined with age, this rapid sugar release can lead to a noticeable spike in blood glucose levels. This is often followed by a subsequent crash as the body attempts to regulate the elevated sugar, leading to fluctuations in energy levels and potentially increased feelings of fatigue or shakiness. More importantly, these blood sugar roller coasters can trigger a stress response in the body. When blood sugar levels rise and fall erratically, the body may release stress hormones like cortisol. Elevated levels of stress hormones can contribute to increased blood pressure and a tightening or constriction of blood vessels. This increased vascular tone, coupled with the potential strain on the circulatory system caused by fluctuating glucose levels, can, over time, contribute to a higher risk of cardiovascular events, including strokes. To effectively enjoy the nutritional benefits of raw carrots while minimizing these risks, a few simple dietary adjustments can be highly beneficial. Pairing raw carrots with sources of protein or healthy fats, such as a small handful of nuts, seeds, or a dollop of plain yogurt, can significantly slow down the absorption of sugars into the bloodstream, promoting a more stable and gradual rise in blood glucose. Consuming carrots earlier in the day, when the body's metabolic machinery is generally more active and responsive, can also help in processing these sugars more efficiently. By adopting these mindful eating practices, seniors can continue to incorporate this nutritious vegetable into their diet without inadvertently exacerbating blood sugar fluctuations or increasing their risk of vascular complications, ensuring that their dietary choices actively contribute to their overall health and well-being. Garlic, an aromatic bulb revered across cultures for its culinary versatility and its potent medicinal properties, has long been celebrated for its purported cardiovascular benefits. Scientific research has indeed highlighted garlic's ability to positively influence various markers of heart health, including its potential to help lower blood pressure and cholesterol levels, and its remarkable antioxidant and anti-inflammatory effects. However, one of garlic's most significant biological actions, particularly in its more concentrated forms or when consumed in larger quantities, is its natural blood-thinning capability. This property stems from its active compounds such as allicin, which can inhibit platelet aggregation, the process by which blood platelets clump together to form clots. For individuals who are already taking prescription anticoagulant medications such as warfarin, heparin, or the newer direct oral anticoagulants, DOACs, the addition of garlic, especially in concentrated supplement form or in very large amounts, can create a synergistic effect that leads to an excessive thinning of the blood. This heightened anticoagulant state significantly increases the risk of bleeding, and in the context of senior health, this risk is particularly concerning when it involves internal bleeding, especially in the brain. A spontaneous intracranial hemorrhage or bleeding within the skull can have devastating consequences, including stroke, permanent neurological damage, or even death. Therefore, for individuals over the age of 60 who are on blood-thinning medications, a cautious and informed approach to garlic consumption is essential. While complete avoidance may not be necessary for everyone, it is crucial to understand the potential interactions. Cooking garlic, a common culinary practice, can often mitigate some of its more potent medicinal effects, including its blood-thinning properties, as heat can alter the chemical structure of its active compounds. Consuming garlic in moderation as a flavoring ingredient within meals rather than relying on concentrated garlic supplements or consuming very large raw quantities is a far safer approach. This allows for the enjoyment of garlic's flavor and some of its milder health benefits without posing a significant risk of over-thinning the blood. As with any dietary consideration that involves potential interactions with prescription medications, open and honest communication with a healthcare provider is paramount. A doctor can provide personalized guidance based on the individual's specific health status, current medications, and the risks and benefits associated with garlic consumption, ensuring a balance between enjoying flavorful and potentially healthy foods and maintaining essential safety. Onions, another ubiquitous culinary staple offering a unique flavor profile and a wealth of health-promoting compounds, also warrant a careful consideration within the context of senior health, particularly for those managing cardiovascular conditions and blood pressure. Onions are particularly rich in quercetin, a potent flavonoid antioxidant with demonstrated vasodilatory properties. Quercetin works by promoting the relaxation of blood vessel walls, leading to their widening, which in turn can contribute to a lowering of blood pressure. This effect is generally beneficial and contributes to the overall heart-healthy reputation of onions. However, for individuals who are already taking medications designed to lower blood pressure, such as ACE inhibitors, beta blockers, or calcium channel blockers, or who are taking other vasodilating medications, the combined effect of both the medication and the quercetin in onions can lead to an exaggerated drop in blood pressure. This phenomenon is known as hypotension, a condition where blood pressure falls too low. While chronically high blood pressure is a significant health risk, excessively low blood pressure can also be dangerous. It can lead to insufficient blood flow to vital organs, including the brain, resulting in symptoms such as dizziness, lightheadedness, fainting, and in severe cases, reduced oxygen supply to the brain, which can mimic or even contribute to stroke-like symptoms. This is because a consistently low blood pressure may not provide adequate perfusion pressure to ensure that the brain receives the oxygen and nutrients it needs to function optimally. Therefore, for seniors who are on antihypertensive medications or have a history of low blood pressure, it is advisable to consume onions in a way that moderates their vasodilatory impact. Cooking onions, similar to garlic, can alter the bioavailability and potency of their active compounds. Incorporating cooked onions as a flavor enhancer, adding depth and taste to dishes without necessarily making them the central component of a meal is a prudent strategy. This allows seniors to benefit from the palatability and some of the beneficial compounds in onions while minimizing the risk of an excessive drop in blood pressure, especially when consumed at night, when blood pressure naturally tends to lower. Again, this underscores the importance of personalized dietary advice and open dialogue with healthcare professionals to ensure that all dietary choices are made in harmony with existing medical conditions and prescribed treatments, safeguarding overall health and well-being. Corn, often categorized alongside other vegetables in a broad culinary sense, functions more akin to a starchy carbohydrate or grain due to its high starch content and its rapid conversion into glucose within the body. This unique metabolic characteristic presents a distinct consideration for seniors, particularly those managing or at risk of developing diabetes or experiencing fluctuations in blood sugar levels. Unlike many leafy greens or fibrous vegetables that release their sugars slowly, the starches in corn are quickly broken down by digestive enzymes into simple sugars, primarily glucose. When this occurs, especially when corn is consumed as a standalone component of a meal or in larger portions, it can lead to a rapid and significant surge in blood glucose levels. This initial spike in blood sugar is often followed by a subsequent sharp decline, a phenomenon commonly referred to as a sugar crash. This cyclical pattern of blood sugar elevation and subsequent dip can place a considerable strain on the body's regulatory systems. For seniors whose insulin sensitivity may have decreased with age, this erratic blood sugar behavior can be particularly challenging to manage. The repeated cycles of high and low blood sugar can contribute to systemic stress and inflammation, and importantly, can negatively impact the health and function of the circulatory system. The rapid shifts in glucose levels can promote oxidative stress and endothelial dysfunction, processes that contribute to the hardening and narrowing of arteries, thus increasing the risk of blood clot formation and cardiovascular events, including strokes. Therefore, it is advisable to approach corn consumption with a degree of mindful planning, especially for older adults. Rather than serving corn as a primary vegetable side dish without complementary foods, it is best consumed as an occasional accompaniment, a modest addition to a meal. Pairing corn with sources of protein such as lean meats, fish or beans, and healthy fats like avocado or olive oil can significantly help to slow down the rate of sugar absorption into the bloodstream. This creates a more gradual and sustained release of energy, preventing the drastic spikes and crashes that can strain the circulatory system. Furthermore, avoiding corn late in the evening, when metabolic processes naturally slow down, can also be beneficial in managing blood sugar more effectively and reducing the potential for overnight metabolic disturbances that could indirectly impact cardiovascular health and stroke risk. Asparagus, another nutritional gem from the vegetable kingdom, celebrated for its vibrant green spears and its array of vitamins, minerals, and fiber, shares a common physiological characteristic with romaine lettuce. It acts as a natural diuretic. This means that consuming asparagus can stimulate the kidneys to increase urine production, leading to a greater expulsion of fluid from the body. While this diuretic effect can be beneficial in promoting detoxification and assisting with fluid balance for many individuals, it can present a nuanced challenge for seniors, particularly when consumed in larger quantities or later in the day. As discussed previously, the aging process often brings about a natural decline in the body's ability to maintain optimal hydration and fluid regulation. This inherent susceptibility is further amplified when seniors are also taking medications that possess diuretic properties, a common practice for managing conditions such as hypertension or heart failure. The combined effect of asparagus' natural diuretic action and prescribed diuretic medications can lead to an increased risk of dehydration. Even mild dehydration can have a cascade of physiological consequences, one of the most significant being an increase in blood viscosity. When the body loses excessive fluid, the blood becomes more concentrated, making it thicker and more prone to forming clots. This heightened tendency for clot formation is a critical concern, as blood clots are a primary cause of ischemic strokes, where a clot blocks blood flow to the brain. The risk is further amplified during the nighttime hours when the body is in a state of rest and circulation might be naturally somewhat reduced. Therefore, for seniors, especially those with pre-existing cardiovascular conditions or those on diuretic medications, a strategic approach to asparagus consumption is recommended. Consuming asparagus earlier in the day is a crucial dietary modification. This allows the body ample time to rehydrate and re-establish fluid balance before the onset of sleep. Ensuring consistent and adequate fluid intake throughout the day is equally paramount. By proactively drinking sufficient water and other hydrating fluids, seniors can effectively counteract any fluid loss induced by asparagus or their medications, thereby maintaining optimal blood volume and viscosity. This simple yet effective strategy helps to significantly reduce the risk of dehydration-induced blood thickening and the associated increased risk of clot formation and stroke, allowing seniors to continue enjoying the nutritional benefits of asparagus safely and without undue concern. Tomatoes, the vibrant and versatile fruits often treated as vegetables in culinary contexts, belong to the nightshade family, a group of plants that, while offering many nutritional benefits, also contain specific compounds that can elicit varied responses in different individuals. Tomatoes are rich in vitamins like C and K, potassium, and lycopene, a powerful antioxidant. However, they also contain compounds that, in some individuals, particularly those who are sensitive or whose physiology is altered by age or certain conditions, can trigger inflammatory responses or lead to unpredictable fluctuations in blood vessel tone. This means they can sometimes cause blood vessels to constrict unexpectedly or dilate excessively. This variability in vascular response, coupled with the inherent acidity of tomatoes, can potentially disrupt the delicate electrolyte balance within the body. Electrolytes such as sodium, potassium, and magnesium are crucial for a multitude of physiological functions, including nerve signal transmission and muscle contraction, both of which are vital for maintaining stable blood pressure and regulating circulation. When this balance is disturbed, it can manifest in symptoms that, unsettlingly, can mimic the early warning signs of a stroke. These might include sudden weakness or numbness on one side of the body, confusion, difficulty speaking or understanding, dizziness, or severe headache. Furthermore, the acidity of tomatoes can sometimes exacerbate gastrointestinal issues or contribute to heartburn, which, while not directly a stroke risk, can be uncomfortable and distract from overall well-being. To mitigate these potential risks, particularly for seniors, gentle cooking methods are often recommended for tomatoes. Heating tomatoes can break down some of the compounds that may trigger inflammatory responses or vascular instability, making them more easily digestible and less likely to cause adverse reactions. Enjoying cooked tomatoes earlier in the day when the body's metabolic processes are more robust and capable of handling these compounds is also a prudent strategy. Pairing tomatoes with foods rich in magnesium, such as leafy greens, nuts, or seeds, can be particularly beneficial. Magnesium plays a crucial role in vascular health and can help to regulate blood vessel function and counteract some of the potential negative effects of tomato consumption. By adopting these mindful dietary practices, seniors can continue to incorporate tomatoes into their diet, benefiting from their nutritional value while minimizing potential risks associated with their acidity and unique chemical composition, thus promoting a safer and more comfortable dietary experience. It is of paramount importance to reiterate that the vegetables discussed, spinach, broccoli, romaine lettuce, carrots, garlic, onions, corn, asparagus, and tomatoes, are not inherently detrimental to human health. Indeed, they form the bedrock of a healthy diet, providing essential vitamins, minerals, fiber, and antioxidants that are vital for overall well-being. The critical distinction lies not in the inherent nature of these foods, but in the intricate and often subtle ways in which an aging body processes and responds to them. As our biological systems mature, they undergo a series of physiological adaptations that can alter nutrient absorption, metabolism, and excretion, as well as the responsiveness of cardiovascular and renal systems. Therefore, what might have been a universally beneficial food in earlier life may require a more considered approach as one navigates the complexities of seniorhood. The key to safely and effectively incorporating these nutritious foods into the diet of older adults lies in a sophisticated understanding of these age-related changes and in implementing mindful dietary strategies. This involves paying close attention to the timing of meal consumption. For instance, consuming foods with diuretic properties earlier in the day, or high-starch vegetables in moderation and paired with protein can significantly influence their impact on hydration and blood sugar. Portion control also plays a crucial role, as larger quantities of certain compounds might overwhelm the body's capacity to process them efficiently. Crucially, acknowledging and understanding the potential interactions between dietary components and the plethora of medications and supplements that seniors commonly take is indispensable. This knowledge empowers individuals to make informed choices that avoid adverse effects. Furthermore, prioritizing adequate hydration throughout the day is a fundamental pillar of senior health, helping to maintain blood volume and viscosity and counteracting the effects of diuretic foods. Establishing consistent meal patterns can also contribute to more stable metabolic processes. Most importantly, fostering open and continuous communication with healthcare providers, doctors, registered dietitians, and pharmacists is the most effective strategy for navigating the nuances of senior nutrition. These professionals can offer personalized guidance, assess individual health statuses, and help tailor dietary recommendations to specific needs and risks, thereby ensuring the maintenance of health, independence, and a high quality of life. Ultimately, the pathway to a longer, healthier life as we age is paved with informed awareness and proactive self-care, not through unnecessary restriction, but through a deeper understanding of our body's evolving needs and a collaborative approach to health management. This information is intended for general educational purposes only and should not be construed as a substitute for professional medical advice. Always seek the counsel of your physician or other qualified healthcare provider before making any significant changes to your diet or health regimen.